Hi, I'm Dr. Jay Calvert, and I just want to talk a little bit about breast surgery. I perform a lot of different operations on the breast. Breast augmentation, probably most common, breast reduction, second most common, and then breast implant removal has become common in my practice. There's been a lot of controversy and discussion about breast implants, and many people are still getting breast implants, and many people are choosing to have them removed. These operations are very personal, and getting the information that you need to make good choices is really important. When it comes to breast augmentation, the type of implant that we use, the approach, how big, small, whether there's lifts involved, these are all things that have to be decided at a consultation. So unfortunately, when you call in and say how much for breast augmentation, we're not going to be able to answer that with a very specific price because we don't know what operation you need until we see you. Having that consultation and doing a physical examination are the ways that we can get you to the cost of the procedure. And the cost varies. It varies anywhere from $10,000 to $30,000 depending on what needs to be done. When it comes to breast implant removal, it's a little more straightforward. But again, sometimes we do implant removal with fat grafting, sometimes we do implant removal with a breast lift, sometimes we just do straight breast implant removal. These are all things that have to be decided at a consultation. So once again, difficult to pin down a price point. Breast reduction, same thing. Sometimes we're doing liposuction of the armpits, sometimes there's insurance involved. Sometimes it's just straight cash price, but we can't decide that until we see you. So for your breast operation, I recommend that you come in, have a consultation, and get the information that you need. And it's very important that you know what you want to achieve with your results so that we can talk about how to get you there. It's very, very hard for us to see through the phone and tell you what it's going to cost to do these things. And I know that that's a big issue when it comes to plastic surgery. This stuff is not cheap. It is expensive. There's an operating room fee involved. There's a surgeon fee involved. If there are implants, that's another cost. There's an anesthesiologist to pay. Sometimes there are biopsies and pathology reports that are all part of the process. Understanding that process is the key to success. And we have been doing this for a very long time. My practice has been here in Beverly Hills for 15 years, and I've been finished with my residency since 2001, so I've been around. And that experience counts for a lot when it comes to getting great results. I look forward to seeing you in the office, and please give us a call if you have any questions.